Let's ask some questions about our aminoglycosides. The following is true about aminoglycosides. A. Aminoglycosides bind to the 30S subunit of the bacterial ribosome. B. Aminoglycosides have no cell wall activity. C. Gentamicin and tobramycin are associated with vestibular ototoxicity. Amikacin and kanamycin are associated with auditory ototoxicity. And D, all of the above is true. And the right answer is all of the above is true. Let's do another question, a girl with a red rash. A 12-year-old woman has severe staphylococcal skin infection after a motor vehicle accident. She is intubated and ventilated in the intensive care unit. She was started on an intravenous vancomycin drip. She develops a body-wide rash without wheals. Her core temperature has climbed to 37.9 degrees Celsius. Her blood pressure is 112/77. Her heart rate is 109 beats per minute. Her white count is 23. What is happening to this patient? A. She has a leukemic rash. The patient has had a progression of her undiagnosed leukemia with a leukemic rash. B. Severe renal failure due to acute tubular necrosis with a uremic rash. C. Septic shock. The septic meningitis is now a global sepsis with severe peripheral vasodilation. Or D. She has developed a cutaneous reaction due to the vancomycin. Which is the right answer? Good. She's developed a cutaneous reaction. So, although a leukemic rash is a possibility, she does not fit the clinical picture, and it seems kind of an unlikely diagnosis. Acute tubular necrosis is not a common reaction to vancomycin. Sepsis is certainly an important consideration and your major differential diagnosis here, but her heart rate is within acceptable limits for a child in an intensive care unit, and the blood pressure is actually pretty normal. She would have a much lower blood pressure if she were septic. The correct answer is going to be D. She's having an acute reaction called red man syndrome, a well-known side effect of high-dose vancomycin. Let's pick the true statement. A. Tetracyclines are broad-spectrum antibiotics that bind to the 50S subunit of the bacterial ribosome. B. Aminoglycosides are broad-spectrum antibiotics that bind to the 50S subunit of the bacterial ribosome. And C. Macrolides are broad-spectrum antibiotics that bind to the 50S subunit of the bacterial ribosome. Good. Macrolides are broad-spectrum antibiotics that bind to the 50S subunit of the bacterial ribosome. So remember, tetracyclines and aminoglycosides bind to the 30S subunit. Let's take a look at penicillin. Penicillin acts through the following mechanism. A. Reduction of calmodulin. B. Increasing beta-lactamase activity. C. Inhibiting beta-lactamase activity. D. Inhibiting the cross-linking of peptidoglycan molecules. Or E. Substitution of the alanine terminal for the lactate terminal. The answer is D. Inhibiting the cross-linking of peptidoglycan molecules. Calmodulin has nothing to do with antibiotics. Beta-lactamase activity is how bacteria become resistant to penicillin. Substitution of the alanine terminal for the lactate terminal is how organisms are thought to become resistant to vancomycin. It doesn't have anything to do with penicillin per se. Let's do another question on septicemia. So a patient has had a known allergy to penicillin 5 years ago with a severe rash and low blood pressure. Which of the following medications would be appropriate for use in a gram-negative septicemia? Would it be A. cefotetan, B. amoxicillin, C. amoxicillin clavulanate, D. methicillin, or E. aztreonam? Good job, you picked E. So amoxicillin will probably have a cross allergy with penicillin, as it is so similar structurally. Methicillin is also a penicillin, may also have a cross allergy. Cefotetan is a cephalosporin and has a lower likelihood of cross-allergy and may be a reasonable choice if it weren't for the fact that we have another choice on the list. Cefotetan is otherwise excellent at gram-negative infections, particularly septicemia. Aztreonam is an antibiotic with no penicillin cross-allergy, and the answer is E. Now, the reason why we have this question here is to reference the lack of cross-allergy of Aztreonam with penicillin as a learning point. Okay? The following statements are true about vancomycin except vancomycin is not easily absorbed when taken orally. It is effective for treating bowel infections. Vancomycin does not cross the blood-brain barrier. In cases of refractory septic meningitis, patients have been given intrathecal vancomycin. C. Vancomycin is an effective agent against staph, although recently resistant strains have been implicated in hospital breakouts. And D. Vancomycin is a broad-spectrum antibiotic. The answer is D. So this is an incorrect response, so it's the correct answer. Remember, we're asking which are true except, so the other three are true. So vancomycin is a large polar molecule that does not easily cross barriers. The transmembrane pores do not commonly let vancomycin across because it's such a big molecule. Now, we take advantage of this characteristic to use it against certain infections, like bowel infections, as it tends to stay in the bowel and act directly on organisms trapped in the bowel. It is not known for crossing the blood-brain barrier, so a lot of times we may use intrathecal administration in cases of very severe meningitis with responsive organisms. Now, do not mistake its incredible effectiveness against gram-positive bacteria as being a broad-spectrum agent. A broad-spectrum agent is one that crosses the gram-positive, gram-negative, anaerobe sort of barriers, whereas vancomycin is really a gram-positive agent in its truest sense. There you have it. We covered a very large topic. I know you're going to do well in your exams. Show them what you know.